Cardinal Health's strategic business goals are to reduce our volatility around our commodity pricing, mitigate our risks, and understand where our risks are coming from in order to hedge against those risks. Other resources did not provide recommendations to help us understand where prices were going. When managers have more accurate forecasts, they can build savings into their cost structure to maximize margins. We also wanted to provide each sourcing manager with help analyzing the latest pricing trends and making the best decisions. Cardinal Health faces many challenges around information. One of the key challenges is to understand all of the information that we are exposed to. This information will allow us to help hedge against our budgets and our forecasts to better tighten our controls in order to maximize our margins. We now have information that tells us where the marketplace is going from a macro and a microeconomic perspective. We also get the story behind the price for a holistic understanding. It's not just a price on a piece of paper. For example, many people are wondering what impact ISIS in Iraq will have on the price of oil. That's a valid question. And the reports we receive now provide the kind of context to help us understand topics like that. The tool that I built now takes into account all the drivers of pricing we now have access to. As a matter of fact, we can now prove to our auditors that we can better understand our portfolio landscape and can now safely limit our exposures. When we do our planning, we can plug in different scenarios and do what-if analysis to determine how they might impact pricing. When we build a budget, we need to set a baseline in December and build our margins off of that line. We can now budget more robustly, leveraging what I have built and now understand and tie back to the IHS price indices and the analysts' insights. We can now better explain why we budget a particular number so we can more tightly control our margins. In the past 8 months, we've been able to push back on 6 different price increases from different suppliers. In one case, the vendor said the price of high-density polyethylene had gone up 7%. We were able to respond that the price actually only increased 3% based on IHS data, while the rest of the increase was due to business costs that were the supplier's responsibility, saving 4%. In another instance, we were looking at potential increases in the cost of stainless steel, but our data told us that the price had actually gone down. We were able to negotiate aggressively to completely mitigate that increase. Cardinal Health currently hedges diesel fuel and is looking to expand into the resins and plastics space. We've integrated more comprehensive information and analysis into our strategic and tactical processes. It's increasingly becoming part of our corporate DNA.